My name is Jocelyn Invernon and I am a PN student at Williston State College. Hi Mr. Smith, my name is Jocelyn and I'm going to be your student nurse today. Today I'm going to be completing a full bed bath, oral care, and we're going to be changing some linens. Do you have any questions? No questions. So I've already checked my client's chart. There is no positional limitations because there will be some rolling involved today. The temperature of the room is set at a comfortable level for the bed bath, and I'm going to begin. So first thing I would do is complete proper hand hygiene and then apply gloves. And I already have my bath in progress sign up. To begin, I'm going to take the soiled comforter off my client's bed. And I'm going to be rolling it into itself, away from my uniform. And putting it into the soil linen bin. Next, I'm going to change my gloves and I'm going to put a bath blanket over my client and take the flat sheet out as well. So I'm going to need assistance for this part. For the purpose of the video, my client is unconscious, so my partner here is going to hold the bath blanket up so I can pull the flat sheet out the bottom. Same with the flat sheet, I'm going to be folding it away from my uniform, soiled or not. Folding it into itself, keeping all the contaminants inside. Putting that inside the soiled utility as well. Changing my gloves. So next I'm going to gather all of my materials. So first thing, I need my basin. I need a clean washcloth, some soap, and a hand towel to line the table. And towels. So to begin, I will be starting on my client's face. I'm going to place this towel over their pillow just to protect it from any water. That's not plugged in, okay. So for this, I'm going to be using hot water, no soap for the face, and to check the temperature to make sure it's not going to burn my client, I'm going to apply it to the inner wrist of my arm to make sure it's not too warm. So first I'm going to dampen my cloth, wring it out, and create a mitt. So to start on the face, you always start at the eyes, and you're going to clean from the inner canthus to the outer canthus, rotating your glove and doing it once again, and rinsing your rag. The purpose of that is to keep any cross-contamination, and if it's visibly dirty, I would redo it again. So for the purpose of the video, I'm just doing one side of my client, but in a clinical setting, I would start at the side furthest away from me, working to the side closest to me. And after I clean the eyes, I'm going to do the face. And I'm going to start up at the forehead, working my way down the cheek and down to the chin. And same thing with the other side, rotating my mitt. Starting at the forehead, down the cheek, and into the chin. And I'm going to rinse, and I'm going to use soap for this part. I'm going to do the mitt again and do my client's neck. Starting at the back of their ear, down their neck to the front of the neck. And I would do that furthest away, working to me, of course. And next, I'm going to take my client's gown off them. Making sure to just protect my client's privacy with this bath blanket while I'm doing so. And this is going to go into soiled utility, away from my uniform, clean gloves, fresh clean water, and I'm going to use my extra towel, laying it across my client's chest. This is going to be for protection and for drying as well. Okay, so this part I'm going to be using soap once again. I'm going to make my mitt, and I will be doing their chest. Using the towel for protection, I'm going to start at the top of the chest, working my way down and under the breast tissue, rotating my mitt as I'm doing so all the way around, cleaning my mitt. And it's really important while we're doing this, especially on females, to look for excoriation, any yeast production, any lacerations, and it's extremely important to make sure that you're drying the area well, because this is an area that doesn't get very much airflow. So next I'm going to fold the towel up and the bath blanket down, exposing my client's abdomen. And I will be using soapy water, dampening, rinsing, wringing out, creating a mitt. Same thing for this. I'm going to be doing one part of the abdomen, so I'm going to go down that way, rotating my mitt, coming down the other side, rotating my mitt, and doing the other side. And since I'm using soap, I'm going to do the process again and rinse the soap off. Same thing with rotating my mitt. And I'm going to go ahead and dry them off. And I'm going to make sure that my towel that I am using for drying isn't too damp at this point. And if it is, I can just get a new one. I'm going to put my bed rail down. And now, if the bed was turned on, I would move it to a working height, but it won't move. So from here, I'm going to move the towel from under my client's head and put it under my client's upper extremity. And this is just to protect the bed from the water or soap, and only exposing the area that we're going to be cleaning. So for this part, I'm going to be using soap once again, fresh clean water, making a mitt, and always cleaning from distal to proximal and supporting my client's joint. So if I were going to grab them here, I'm going to start from the wrist, moving up towards the shoulder, do all aspects of the arm while rotating my glove, and same with the side. And I'm going to wring it out, get fresh water, cleaning the axilla area as well, all while rotating my mitt. And I'm going to do this all over again, rinsing all of the soap off. And then I'm going to dry the area. Really important to dry the underarm really well, because that can cause skin irritation. Okay, now I'm going to take this out and move to my client's lower extremity. Once again, only exposing the area that needs to be exposed and protecting the bed with a towel. I'm going to get nice clean water, and we will be using soap again. Oops. I'm going to dampen my rag, wring it out, creating a mitt. And just like the upper extremity, we're going to be going distal to proximal with long strokes, and this for both areas just going to promote venous return. All while rotating the mitt of my glove and supporting that joint. Doing it all over again to rinse any soap off. And then I'm going to dry. Okay, and next I'm going to move to my client's feet. So I've already checked their chart. They do not have diabetes or anything that would affect circulation or sensation. And I'm going to be soaking their foot in fresh water with soap. And for this, I don't need a rag. I can just use my hands. So I'm going to assist them to bend that knee and put their foot directly in the basin. So while doing this, I'm just going to clean the upper part of their foot, all aspects in between the toes. And if it's visibly dirty, just doing so until it's no longer dirty. so now I'm going to get clean water without soap, and I'm going to change my gloves, and we're just going to rinse the foot now. And once that is good and rinsed off, we're going to dry it and get new soap, new water, soap, and gloves. Drying in between all of their toes and everything there. Okay, and now I'm going to cover them back up. I'm going to move to the back and the rectal area. And for this, I'll need assistance, please. So before we begin, it's important to move your client furthest, closest to me. For when we roll, they won't get their face on that side rail. And I'm going to have my patient cross their arm and bend this leg, and have my assistant roll by the hip and the shoulder. Over. Okay, and then I'm going to put my towel down. Once again, just protecting the bed from any of the soap and water. Going to get fresh gloves, fresh water. We will be using soap for this as well. Get my rag wet, rinse it out, and creating a mitt. On the back, we'll be doing long strokes as well, all while rotating my mitt. So starting from the shoulder, working my way down, and doing the same thing. I'm going to rinse this out, and we're going to go over it again, just getting all of that soap off the area. And from there, I'm going to dry off their back and then do the rectal area. So while doing this, I'm going to observe the area. If there's any stool, I'm going to use toilet paper first, and then I'm going to do the same thing, soapy water fresh, creating a mitt. I'm going to start on the upper end, and I'm going to work my way front to back. So I'm going to clean this way, all while rotating my mitt, doing each side, and then doing the middle. And obviously if the area was still visibly dirty, going over it again, and then rinsing and drying really well. I would put this into the dirty linens with this as well, new gloves and fresh water. And we're going to return my client to their back into a comfortable position. Thank you. I'm going to raise my side rail, and now I'm going to do perineal care. And to do this, it's really important to use your bath blanket to your advantage. So we're going to make my bath blanket into a diamond shape, so I can use part of it to wrap around my client's legs. And the purpose of that is just to make them feel a little more covered up during this process. So we're going to bend them at the knee here, use one corner, and we're going to wrap their lower part of their leg like this, and their foot as well. Doing the same thing to the other side, bending the knee, using this part of the blanket to wrap the leg and the foot. And that just leaves this flap right here to fold up and to expose the perineal area so I can do care. So I have fresh gloves, fresh water, fresh everything, and I'm going to let my client know that we're going to lift up and expose. And for this area, I will be using soap. I'm going to create a mitt again. And while doing perineal care on a female, it's important to start on the side furthest away from you. And you're going to do the labia furthest away from you, starting from the pubic symphysis, working your way down to the rectal area, flipping your mitt, doing the same thing on the other labia, and then using the other side of your mitt to go from the vulva down to the rectal area. And we're going to, I would typically put this right here to make sure the bed doesn't get wet. After that, we're going to be drying the area really well too. If there's any skin folds, making sure you're washing those and drying those as well. Now I'm going to get a new towel, a new rag, new gloves, and new basin of water. And I'm going to return my client to a comfortable position and the bath blanket to the way it is supposed to be. Okay, and now I'm going to put on a clean gown on my client. So once again, using this bath blanket to my advantage and just protecting my client's privacy while doing so. Okay, making sure that it's on comfortable and secure. And next I'm going to do oral cares. So I can get rid of both my towels, my wash rag, and I'm going to gather all of my materials to do oral care. So for this, I'm going to need a clothing protector, and I'm going to put this underneath my client's head and over the part of their new gown that would be affected by any spillage. Then I'm going to, his head doesn't move, but I would move it to the side so the liquids can drip out. And I would use this kidney basin underneath the side of his face to catch any of those fluids. So unconscious patients, when something enters their mouth, it's very common for them to bite down. So to protect my fingers and the materials we're going to be using, you would use a padded tongue blade. So you would insert into the client's mouth and then turn it horizontally in between the upper and lower jaw. And the solution that I'm going to be using is part mouthwash, and it's going to be part warm water and a toothette. So I'm going to dampen the toothette, and I'm going to clear this side first. I'm going to clean in between the cheek and their teeth, the upper palate and their teeth really well. And then I'm going to discard, get a new one, and do the same thing with the lower side. In between their cheek and their teeth, on the side of their tongue really well. Discard, get a new one. I'm going to discard this as well and get a new one. Move it to the other side of the mouth, the same way. And I'm going to do the same thing on the other side. Cleaning the upper palate in between the cheek and the teeth. Discard, get a new one. And then I'm going to be doing the tongue in between the cheek and the teeth once again. Then I'm going to discard, drain and rinse this. And then I'm just going to make sure that my client doesn't have any fluid running down their face or their neck. And this is going to go into the dirty linens. So next I'm going to be doing a occupied bed change. So I'm going to need help for this. I would get clean gloves. And to start, we are going to roll my client towards my assistant here, moving my client towards me first. Okay, bending this leg closest to me and supporting at the hip and the shoulder to roll. Okay, making sure that their head is still supported by that pillow, I'm going to loosen my fitted sheet and fold it over with my draw sheet. Assuming that this is soiled, so we're going to fold it into itself in a way so it does not touch my new linens, just kind of creating a little bit of a barrier. And I'm going to start with a fitted sheet. both sides here. What is happening? Okay. And I'm going to make sure that this goes underneath that soiled utility here. Tucking it, keeping it nice and clean. This does not want to stay on the bed. And then next, I'm going to do my draw sheet. I'm going to tuck this underneath that as well. Making sure that it is nice and clean and tight and no wrinkles. And I'm just going to inform my client that there will be rolling over a little bit of a hump. Okay. I'm going to switch positions with my assistant. We're going to move my client towards me and then prepare to roll. Moving that pillow over once again just to support that neck. And we're going to fold the dirty linens into themselves away from my uniform and the clean sheets and put those into the soiled utility as well. I'm going to get fresh gloves. I'm going to come back. I'm going to pull my clean linens over. My draw sheet over, making sure there's no wrinkles. And then I'm going to return my client to their back. Okay. And next, I will be doing the flat sheet. Since my client is unconscious, I'm going to have my partner here hold this up so I can pull that bath blanket out the bottom. Folding it into itself and away from my uniform. Here, into soiled utilities. I'm going to get fresh, clean gloves. And I'm going to make sure that the sheet does not touch the ground and it's even on both sides. And then I'm going to do the comforter. Okay, so with the comforter, doing the same thing, making sure that it's going to be even on both sides. And I'm going to always miter my corners. So I'm going to, don't miter individually, you're going to wait until you have your flat and your comforter on. You are going to, oh, this is a weird bed. You're going to tuck the front in first. You're going to gather both sides of this. And you're going to fold it that way, tucking your sides in. And you're going to pull your mitered corner over. And you're going to do the same thing on the other side. Pulling that up and tucking that. Just making sure that the bedspread is even and it's comfortable. And then next I'm going to get new gloves and I'm going to do denture care. So for this, I'm going to need a toothbrush, toothpaste, and my cup of dentures. But before I start, I'm going to do my pillowcase. Do a fresh pillowcase, dirty one going into the soiled utilities, fresh gloves. Okay, put that back under my client's head, making sure that they're comfortable. There. Now I'm going to do denture care. Fresh gloves, and for this you are always going to line your sink with a, I'm going to pretend this is a clean towel. With a clean towel. Dentures do slip out of your hand sometimes, so this is just a little extra padding to make sure you don't break them. You're always going to wash them separately. So you're going to start with this toothbrush. You can get some toothpaste, cleaning the teeth on the outside really well, the bottom really well, using cool water, not hot, not cold. Don't want to damage the dentures, and especially important to get the top side. This is where the adhesive is. And so old adhesive can affect then putting it back in. I'm gonna rinse that off, doing the other side, same thing, getting those teeth, bottom side, inner side, and most importantly the top to get all that adhesive out of there. Okay, and it's client preference whether they soak in cool water, they want them back, they soak them in a tablet. Totally up to them. And that is a complete bed bath, occupied bed change, oral care, denture care. Next, I'd make sure that my client is comfortable, clean up my materials, and leave with my soiled utilities and the rest of my materials.